Okay, great. So, hi, welcome to this session. Today, we'll be solving a lot of MCQs, which are a mix of the previous year questions that Christ University asks, and also a few of the questions are memory based, right? So, our resource person has herself given the Christ entrance. She has cleared the interview. She's pursuing her MA Clinical Psychology RCI degree over there right now. And after giving the entrance, she compiled all the questions. So, today we'll be solving exactly that, right? So, yes. How are you all doing? I see about 50 of you here. I'm seeing the list of participants. Some of the names I can recognize. Some of the names are sounding a little new. So, can we just know a little bit about you all? So, how many of you know what the cyclopedia is? How many of you have attended one of the sessions by us previously? And how many of you are the first comers, the new joiners? So if you know what cyclopedia is, if you know us, then you could probably just do a hand raise, or those of you who are new here, you can just write new in the chat box. So I see Sharanya here. Sharanya, Anushka, okay. And I saw a few more names in the chat. Yeah. So sounds like a lot of you are new here. So on that note, I'd also like to introduce you to what the cyclopedia is, who we are, so that you know what you're gonna get into, right? It's important to know about the facilitators in the organization. So Rishika, can you share your screen, please? You were sharing it previously.
Yes, one second.
Yes. So the next slide talks about our introduction. Yes, so those of you who are new, so we are the Cyclopedia and we are a venture established to help students preparing for psychology, entrance exams, and interviews. The co-founders of Cyclopedia are me and Manvi. So my name is Viti Ghai and I am a practicing psychologist and also a student mentor and educator. We have together been running a lot of preparation courses to help students prepare for master's entrances, and CUET PG preparation course is one of our bestseller or hit courses, you can say. So, a little about Manvi and I. So, I personally completed my master's in counseling psychology from Christ Central Campus, and I scored 280 in CUET PG. I was also offered admission into a lot of other colleges like DU, TIS, not TIS, sorry. Yeah, DU, Mahe, and yeah. And about Manvi, so she is about to complete her master's in psychology from Delhi University. And coincidentally, Manvi also scored the same score as me, 280. And we are from the same college, DU. So that's how we came to know each other. Yes. And the resource person for today's session is going to be Miss Rishika Tapadia. And she is currently pursuing MA Clinical Psychology, RCI recognized from Christ University, Bangalore, as I shared previously. And she has also qualified NET GRF with an amazing percentile of 99.95, and she scored an Air A. So we only bring the best resource persons for you. And personally, her teaching style is great. The way how she breaks down concepts for you, the way how she, shares the tricks and tips so that you can remember concepts better. We've taken demo sessions with her, and what stands out for me from her approach is that she won't just make you solve a question, but she'll make you understand the entire concept behind it. So any question from the same topic that comes, you will be able to solve it because she'll tell you what to focus on, what not to focus on, which is why we've invited her because we think she is an amazing person to help you with this. And she also has some clinical experience. So over to you, Rishika. Thank you so much for being here. And I'm sure that everybody will gain a lot from today's session.
Thank you so much, Manvi and Vidhi, for inviting me here and for that amazing introduction that you all gave. I am extremely excited to be over here, and I'm hoping that this course is going to benefit, this particular session is going to benefit all of you a lot. Um, just before we start, okay? just to get an understanding, एक महीना बचा है Christ entrance को. It's on 7th Feb. How is everyone feeling? If you could just rate your preparation on a scale of 1 to 10, what's happening? How's it going? You can just use the chat box to mention. Even if it's, good, not okay, 5 out of 10, that's good. Yes, still wondering where to start. Okay, yes. Let's see how we can help you with that. Mhm. So I am sensing कि थोड़ा डर लग रहा है सबको. Preparation level, as people have been mentioning, it's somewhere around 40 to 50% for everyone. Yes. And you couldn't start because of research. I understand that can be very hectic. But I'm hoping that because it's only 1 month away, this particular session, what we have done is we've tried to focus a lot on high-end questions, and I've tried to keep each and every question from different topics so that you get an overall gist and overall glimpse of what the topics are and what's not. Moving ahead, I will also show you what all topics Christ wants you to focus on more. But before that, I hope we all know that on 7th Feb, we have our entrance test as well as the skill assessment, micro presentation, and personal interview. Something I would like to mention about myself also is that I did my undergrad from Christ University. I did my master's in clinical psychology also from Christ University, and I'm currently doing my RCI also from Christ University. For someone who's been with Christ for so long, yes, I think the entrance test, how they give, and the skill assessment and personal interview is something that I can hopefully help you all with. So, whatever doubts and questions are there, please feel free to put it on the chat box. Okay. Now, just to give you a glimpse of how the entrance exam and the pattern and the syllabus is going to be like, it's going to be a computer-based exam, and there's going to be 120 questions. Roughly, you will get around 1.5 hours, that is 90 minutes, for you to solve all of these questions. And there are no negative marking. Because there's no negative marking, this gives you a lot of plus point. Yes, and definitely there's 1 marks for each question. So the total marks is 120. And the 6 major topics that Christ wants you to focus on this time is general psychology, biology, personality, clinical psychology, research, and cognitive. Okay, so these are the few things that we're going to focus on. Today's MCQs are also more or less revolving around these 6 modules only. I have stuck to this, and we'll see how I can break down the concepts and make it slightly more easier for you. So, if everyone's prepared for it, yes, can you give me a quick heads up on the chat so that we can go and start solving the questions? Yes. Okay, great. Fine. So what we're going to do is I'm going to show you the question, and on the chat box, kindly mention what according to you is the correct answer. And after that, I'll be going ahead and explaining the question. Does that sound all right to everyone? If yes, then let's start with the first question. What according to you is happening in this question? And even if you're confused between any few options, mention that also. There's no right or wrong answers here. So the question is, a test correlates +1 when administered twice, but only plus 0.15 with other creativity tests. This suggests what? Okay, one option that I'm getting is A. Anyone else who would like to try? Okay. All right, yes. Good job, everyone. What you have answered is Extremely correct. And the answer is going to be A, which is low validity and high reliability. Let's try to understand what reliability and validity quickly means so that in future questions आए तो आप आराम से approach कर पाओ. Okay. When we talk about reliability, something that we are extremely focused on looking at is consistency. Okay. Whether or not it is giving the same result again and again. Okay. That is consistency. And validity is what we are trying to understand it. Is it measuring what it is supposed to measure? Measuring what it is supposed to measure. तो अब एक मुझे बात बताओ कि the first half of the question means that one particular test is administered twice. Okay. And based on the answer, we've realized that reliability to high hai. But any idea which reliability is high over here? Which type of reliability? Exactly. Over here, they are talking about the test retest reliability, which basically means कि अगर एक ही टेस्ट को if we do it multiple times, are we getting the same results or not? Okay, so this is going to be the test retest reliability. And based on this particular question, what we have is there's a particular test and we are correlating that particular test with another test. तो ये कौन सा type of validity होगा? Any guesses? Okay, correct. Samiksha Nitya, you have mentioned concurrent validity, which is going to be the correct answer. Concurrent validity basically means कि दो सिमिलर टेस्ट्स को हम कंपेयर करके देख रहे हैं कि कैसा है. सपोज वी क्रिएटेड अ न्यू टेस्ट टू चेक द डिप्रेशन रेट्स or the depression severity. Yes, what we are going to do is we are going to check the validity of our test with already existing tests. For example, हम HAM-D के साथ चेक कर सकते हैं या बेक्स डिप्रेशन इन्वेंटरी के साथ चेक कर सकते हैं फॉर अस टू अंडरस्टैंड वैलिडिटी कितनी है एंड बेस्ड ऑन दैट वी कैन गो फॉरवर्ड. ओके, सो this is your reliability and validity. Now, one particular thing that you will often find in a lot of question papers is that, and you need to remember this, that a test can be reliable without being valid. But the vice versa is not going to be true. Okay? It cannot be valid without being reliable. Okay, a lot of times questions में ना ये वाला question directly पूछा जाएगा या तो घुमा फिरा के पूछा जाएगा. Okay, so please remember that reliability can exist without validity, but validity can only happen as long as the test is reliable. Cool? Understood? Moving on to the next question. Let's try this matched and following. Okay, yes. The correct answer is D. So, according to D, intellectualization is going to be option 3, which means कि after a painful breakup, a person is discussing attachment styles and relationship statistics instead of their feelings. So basically क्या कर रहे हो आप यहाँ पे? आप चीजों के बारे में बहुत ज्यादा सोच रहे हो and you are removing the emotions out of it. Okay, you're basically trying to understand the meaning behind it, why it happened, what made it happen, what could have happened. This is called intellectualization. Okay, and our compensation is option 1. which basically means that a student who performs poorly in academics becomes highly invested in sports to maintain self-esteem. एक चीज में मैं अच्छी नहीं हूँ, so I'm going to do something else to compensate for my shortcomings. Okay. Before we go ahead, can anyone tell me the difference between compensation and sublimation? Anyone wants to take any guess? Okay. You can unmute also for this question. Okay. Sublimation is a healthy defense mechanism. Okay. More than healthy, it's a mature defense mechanism. Okay. Yes. Bani, you are mentioning that sublimation redirects and compensation is for substituting, which more or less is true. It's the crux of it. To expand on it further and give you a slight example, क्योंकि this is something which you will get confused when you're writing your exams. Compensation में क्या होता है? Two different entities are there. For example, I'm not good in academics, so I am going to invest more in sports. You see, there are two different entities which is coming in place. But sublimation में क्या होता है? You have a lot of pent up emotions and feelings and energy, and you're trying to channelize that impulse, channelize that emotions into something. So for us, sublimation might look like ki someone who's highly aggressive in nature, someone who has a lot of anger. Yes, they will try channelizing their particular energy into boxing. Okay, so if you see that the nature of entity is quite similar, that is the difference between compensation and sublimation. So make sure कि जब questions आए, think from this lens. Cool. Now for reaction formation, okay, the correct answer is going to be option 2, which is an individual who feels unconscious resentment towards a sibling becomes excessively caring and protective. Okay, जब भी reaction formation होगा, just imagine opposite. Okay, emotions and actions are opposite to each other. Okay, emotions opposite to action. ऑलराइट, बचपन में आपने देखा होगा या मूवीज में देखा होगा कि when a hero likes the heroine, yes, instead of going and directly approaching, they will try to pick a fight या ऐसे छेड़ेंगे या poke करेंगे. That is a very classic example of reaction formation. Yes, a lot of times this basically means that I am feeling something, but it's too painful for me to accept it or show it. So I'm going to show a different emotion. That is going to be your reaction formation, which is opposite. And lastly, we have rationalization, which jiska example is after not being selected for a program, a candidate claims the course had no real value anyway. Before we go ahead, can anyone explain me the difference between rationalization and intellectualization? This is also something which will be very important for your understanding. So, intellectualization में basically क्या कर रहे हैं? We are trying to make meaning of what exactly happened. Trying to understand, trying to discuss it more, trying to, understand our patterns, where we are coming from. And the focus is more on the event that happened and less on the feelings. Okay? But when it comes to rationalization, rationalization is more about finding justifications, finding excuses to calm your ego. Okay? That particular thing is rationalization. Yes, correct. Sonali and Sunidhi, absolutely correct. Okay. Now, one more thing that you should not confuse is intellectualization versus isolation of affect. आइसोलेशन ऑफ अफेक्ट इज ऑल्सो अ डिफेंस मैकेनिज्म, जो पेपर्स में आएंगे दिखाई देगा। आइसोलेशन ऑफ अफेक्ट में भी हम इमोशंस को हसाइड करके चीजें कर रहे हैं। Intellectualization may be the focus is on everything apart from the emotions. But the main difference over here is, yes, that in intellectualization, we are trying to make sense of what happened in the particular situation, what happened, what the patterns are. But isolation of affect may, it's more in terms of this is too overwhelming for me. So I'm going to reduce the affect. I'm going to look at it very objectively and I'm going to do what is required to be done. So that is intellectualization versus isolation of effect. Hope it's clear. Moving on to the next one. The question is, polyadue is a condition in which a delusional belief is. Let's try to answer this. Okay, correct. So the correct answer is B over here, which is shared between two closely associated individuals. Okay, this word due over here means due. अगर polyatre लिखा होता, then it means shared illusions between three people. अगर quatre लिखा होता, then it means shared illusions between four people. Okay? It's basically a shared psychotic disorder. And you have to understand that in दोनों option में A and B में, in A also it is mentioned two individuals, and in B also it is mentioned two individuals. Okay? But the important word in folie due is this word shared. जैसे ये independent होगा ना, it will not be a shared psychotic disorder. It will not be folie due. It has to be shared. This cannot be independent of each other. Okay? Let me know if the pace is fine. A quick thumbs up if the pace is fine for everyone. Yes, and any confusion in any question, anything that you want to understand?
Ma'am, I actually had a doubt with the
Yes.
previous question, not the one prior to this. Yeah, the one before this.
This one? Huh, yes.
So, you sort of differentiated between intellectualization and isolation of affect, in the sense of like isolation of affect deals with the affect being too overwhelming, so you're trying to reduce the affect. So just in this particular example,
Yeah.
where we say an individual who feels unconscious resentment becomes sorry, yeah, you say after a painful breakup a person discusses attachment styles and relationship statistics. Wouldn't
Yeah.
that also sort of be, reducing affect and focusing more on like finding patterns and things like that? How exactly do you tell apart from intellectualization versus isolation of affect in this particular example?
Okay. All right. So basically, when we talk about isolation of affect, na, उसमें ना, the person is, let's say, talking about the breakup. Yes, but while talking about the breakup, they are not showing any emotions. Okay. They are talking as if कि it happened to a secondary person. उसमें क्या हो रहा है? They are removing the affect out of it. They are showing you a very flat affect. Yes. That is what is isolation of affect. They are not
Okay.
trying to understand the meaning behind it. But
Okay.
intellectualization is, I want to understand what happened. Yes, it's not that they are
Right.
not feeling the emotions, but they are trying to understand it objectively without letting the feelings bias them.
Right.
Is that clear?
Yes, yes. Thank you.
Yes. Sunidhi mentioned, ma'am, can you repeat the difference between the two? What two exactly? This is for folie due. Okay. Yes. So in folie due, what happens is folie due is basically a shared psychotic disorder. So the word keyword over here is shared. So अगर independent individuals form हो रहा है, okay, for example, you and me, we are just classmates, and I have a delusion of infidelity formed, and you also have a delusion of infidelity formed. But my notion of it, my understanding of it, the people involved in my delusion is very different from the people involved in your delusion. Okay? So it's basically कि same delusion form हो रहा है, but दो independent levels पे. But for example, you and me, both of us are forming a shared delusion where both of us feel that, okay, perhaps this particular person is doing this. There are same entities involved, same people involved. It's a shared delusion, a shared belief system that we have created that will be followed you. It's not exactly association by proximity. That does play a role because definitely you have to be near each other, or you have to have a very close outlook of each other's life to form a shared delusion. Yes, but apart from that, it is also seen in people, in a lot of family members जिनका family history में schizophrenia already है. Yeah. So they are more susceptible to forming delusions, and because they live together, they have the same environment, that increases again. Okay. I think you might or might not get the recording. Can someone from Cyclopedia confirm that? Because
Yeah,
so
yeah,
that
she will get the record. Everyone is going to get the
Huh.
recording and the PPT.
Yes. So Tanvi, maybe you can, go back and look at the recording once. Okay. All right. Let's move ahead with the next question. Dash is best described as an inability to recognize faces. Okay. A lot of you are saying D, and there's someone who also mentioned B as the correct answer. Okay. Now let's try to understand. The correct answer is B, which is prosopagnosia. All right. And the other term for this is facial blindness. You are correct in mentioning that it is somewhere related to agnosia. Okay. But agnosia is basically a very broad perceptual deficit which is there. बहुत ब्रॉड अगर परसेप्चुअल डेफिसिट हो तो हम उसको एग्नोशिया बोलते हैं. लेकिन as long जैसे ही recognizing faces is mentioned, no, yes, that becomes prosopagnosia. All right. जहां पे भी facial recognition लिखा हुआ है, that will become prosopagnosia. And one thing that you also need to understand over here, that it is very different from blindness. It's not blindness. इट इज अ परसेप्चुअल डेफिसिट. ऐसा नहीं है कि लोगों को दिख नहीं रहा है, बट द ओनली प्रॉब्लम दैट दे आर हैविंग इज दे आर नॉट बीइंग एबल टू recognize faces or find the difference of expressions in other people in two faces. Okay. It's very different from blindness. Blindness is a organic condition जिसमें दिख ही नहीं रहा है. Okay. Facial blindness or prosopagnosia, it is more of a perceptual deficit that we see. Okay. One more thing that you can get in your question is कि this prosopagnosia happens in the temporal lobe. जब भी temporal lobe में कोई issue होगा ना, तो prosopagnosia होगा. To be more specific, the fusiform face area is what is responsible for prosopagnosia. Okay, so a lot of times ये वाला question भी आ सकता है. Cool. Let's move on to the next question. Wait, I think I missed one question earlier. Someone mentioned, is it cortical blindness or it is prosopagnosia? So cortical blindness में क्या होता है ना? आपके ब्रॉड एरिया में, ब्रॉड विजुअल परसेप्शन के एरिया में डेफिसिट होता है. इट्स नॉट जस्ट लिमिटेड टू फेसेस. ओके. इट कैन बी पीपल, इट कैन बी ऑब्जेक्ट्स, इट कैन बी एनीथिंग. Yes. बट इन prosopagnosia it's only the face recognition जिसमें problem होता है. Okay. All right. I will also talk about the different amnesia, the amnesia and the paraamnesia, which is mentioned. Okay. As we must have read now, okay, amnesia is more about your memory loss. Okay. Wherever we see the word amnesia, the thing that comes up for us is memory loss. All right. आप जब पढ़ोगे एमनीशिया ना दो टाइप के होते हैं. एक होता है ऑर्गेनिक एमनीशिया एंड द अदर वन इज अ पैरा एमनीशिया. ओके. व्हेन वी टॉक अबाउट ऑर्गेनिक एमनीशिया में मेमोरी लॉस होता है, सिलेक्टिव मेमोरी लॉस हो सकता है, रिमोट मेमोरी लॉस हो सकता है. ऑल ऑफ दैट कम्स इनटू प्लेस. बट व्हाट इज द डिफरेंशिएटिंग फैक्टर इज कि एमनीशिया में मेमोरी लॉस होगा, बट पैरा एमनीशिया में memory distortion होगा, which is more psychogenic in nature. For example, anyone who was in a traumatic car accident remembers everything, but car accident में क्या हुआ वो समझ में नहीं वो समझ नहीं पाते. Okay, so that is what is your paramnesia. बट अगर फुल मेमोरी लॉस है कि हाँ आफ्टर द एक्सीडेंट उसके बाद कुछ ही याद नहीं हो रहा है, एंटेरोग्रेड मेमोरी पूरा ही चला गया है, then that will become your amnesia. Okay. Now, a few related concepts that you can study around this, I will just mention. Okay. You can read about the different types of amnesia. For example, हुआ आपका retrograde, anterograde, dissociative amnesia, और dissociative amnesia का एक part है fugue also. You can try that. You can read about blackouts, which you see in a lot of substance dependent cases. Okay, these are few important things that you can read about, which will help you. Okay, all right. Moving to the next question that we were already at. Clear है ना अभी तक? I can move to the next question. Yes. Okay, fine. So the question is, which neurotransmitter is primarily inhibitory in the central nervous system? And what most of you are answering is correct, which is C, GABA. Okay. GABA का रोल क्या है लेकिन? What is the role of GABA? Can you expand? What do you mean by that? Prevents, yes, excitotoxicity. It helps the brain activity to become calm. Yes, which is correct. Okay. Few other things जहाँ पे GABA बहुत ज़्यादा रोल प्ले करता है is your arousal, your anxiety. हमारे स्लीप में भी बहुत ज़्यादा रोल प्ले करता है along with motor controls. Okay, all of this is GABA regulated. Okay, glutamate, as we know by now, glutamate is excitatory in nature. Glutamate का क्या काम है? What is the work of glutamate? Learning. Yes, very good. What else? Learning memory. Correct. The main role is learning and memory. तो हम learning and memory में एक important चीज पढ़ते हैं ना, long term potentiation. Please read about it. This will be helpful in your exams also. Okay. Dopamine is not exactly either inhibitory or excitatory. It is more of a modulatory neurotransmitter. ठीक है. And dopamine, as we all know again, हमारे रिवॉर्ड बिहेवियर में बहुत ज्यादा हेल्प करता है. Okay. And what about norepinephrine? What does norepinephrine do? Excellent. It's responsible for the fight or flight response. तो हमारा जो सिंपैथेटिक नर्वस सिस्टम, पैरासिम्पैथेटिक नर्वस सिस्टम होता है स्ट्रेस के टाइम पे, उस टाइम पे नॉरएपिनेफ्रिन इज रिलीज्ड अ लॉट इन द बॉडी. फाइट और फ्लाइट रिस्पॉन्स में यूज होता है. ओके. नाउ इन केस किसी को याद नहीं रहे कि ये इनहिबिटरी है नहीं है, जस्ट अ निमोनिक दैट आई यूज टू रिमेंबर दैट GABA is inhibitory. GABA basically means break of the brain. ब्रेन में ब्रेक लगता है, मतलब एक्शन पोटेंशियल रुकता है, इसीलिए इनहिबिटरी है. ओके. ये बी से याद रख लो. आई डोंट नो इफ इट्स gonna stick with you guys, but GABA is the break of the brain. All right. Let's move on to the next one. According to Eysenck, extroverts seek to dash their arousal while introverts seek to dash their arousal. Okay, yes. A lot of you are giving the example as option A. Can anyone just quickly unmute and tell me option A क्यों लग रहा है? Okay. Priyanshi is saying option D.
I can take a shot at it. I think
Yes.
from what I remember, according to Eysenck's theory, he said that extroverts are already less aroused, like they have less arousal. So when they go out, they're trying to increase their arousal, and introverts are already very aroused, so they want to reduce their arousal. That's why they're introverts.
Exactly. Correct. So your answer is correct. A. I was just trying to understand कि A और C में confusion तो नहीं हो रहा है ना? Okay. But good job. Correct answer. So basically what is happening is for extroverts, yes, their baseline is already low arousal. क्योंकि low arousal है, they are trying to seek more arousal, like Tweena mentioned that social engagement will increase arousal. Okay. And for introverts, their baseline is high arousal. So they prefer to stay in their own company. They prefer to not engage socially to be able to reduce their arousal. Okay. Good job, guys. I was just trying to test कौन confident है नहीं है. But good job. Let's do the next question. Okay. Someone mentioned option D. ठीक है. They're not trying to reveal or hide. Because not exactly, matlab, when they are going for social engagement or something, revealing or hiding is not something that they are seeking. In the question, what seeking basically means is that internally what they want. Okay, so it will be either decrease or increase. Hide or reveal is more of a trick thing which is given. Okay, but it is more of an internal thing that they are looking forward to. Arousal या तो increase होगा, decrease होगा. Hiding and revealing is not something that we look at according to arousal. Okay, next question. Okay, wait, before we go, can you tell me who gave the term introvert and extrovert for the first time? Who was the first person to introduce this term? Jung. Carl Jung. This was also a very common question that you get asked in your entrance exams. First person to introduce intro and extroverts is Carl Jung. Carl Jung is also a very important concept. मतलब उनका theory is going to be very important. So the archetypes, the anima, animus, all of that, please read. All right, let's do the next question now. Alport's concept of functional autonomy most closely resembles Freud's concept of what? Okay. Masira is saying option C. Anyone else who wants to try? Option C. Okay. All right. The correct answer is option C. Okay. And this is a comparatively more tricky question, जो आएगा question में. So let's try to break the question and let's try to understand why it is going to take us to option C. And I will help you understand कि हम eliminate कैसे कर सकते हैं in types of questions में अपने answers को. All right. Now, when it's written functional autonomy based on the word, it basically means कि आपके जो original drives है, original desires है, it is independent of that. Independent of your original drives. That's why functional autonomy. You can function the way you want. It is not motivated by your desire, your needs, or your drives. That is functional autonomy. Okay? जब हम sublimation देखते हैं, if you notice that in sublimation, the example that we took earlier, aggression बहुत है मेरे अंदर. I am very aggressive. What am I doing? I am channelizing it into boxing. So I am not letting aggression drive my behavior in the manner that I'm going to react to people or I'm going to have a lot of outbursts. Okay? What it is giving me, it's giving me functional autonomy to be able to regulate my emotion, to be able to be independent of the original need that I had. Hence, sublimation will become the correct answer. इसमें क्या हो रहा है? आपके जो primitive drives है, that is being redirected into socially acceptable activities. Okay. Now, reaction formation is basically opposite behavior. हमने ऊपर भी समझा था. ठीक है? Opposite behavior, हमारा emotions और हमारा behavior opposite होता है. ठीक है? तो अगर reaction formation में opposite behavior है, there is no conversation about autonomy coming up. Independence का कोई बात ही नहीं हो रहा है. Okay? So, if we had to, we could remove reaction formation in that manner. Okay? And जब हम introjection की बात करते हैं, introjection basically means क्या है? Internalize कर लेना किसी चीज को. It is an internalizing behavior. Yes? कि कोई हमें कुछ बोल रहा है, हमने internalize कर लिया है पूरा. We see a figure and we've internalized their qualities. अगर internalization हो रहा है, तो autonomy तो किसी वे में आ ही नहीं रहा है. There is no freedom happening. Hence, introjection will also get removed. Yes? I can understand that a lot of people might have been confused between intellectualization and sublimation. Intellectualization इस लॉजिक से अगर आप सोचो कि आई एम ट्राइंग टू मेक सेंस ऑफ द सिचुएशन, तो फंक्शनल ऑटोनॉमी है. ठीक है? इमोशंस के हिसाब से मैं नहीं चल रहा हूं. ओके? बट टू अंडरस्टैंड दैट आवर ओरिजिनल ड्राइव इज स्टिल आई वांट टू प्रोटेक्ट माय ईगो. डिफेंस मैकेनिज्म का मतलब होता है टू प्रोटेक्ट योर ईगो. तो इंटेलेक्चुअलाइजेशन में आई एम trying to make sense of the situation to protect my ego. Yes? So it's still not an autonomous behavior. It's still a route that I am choosing. But in sublimation, you are gaining autonomy by not letting your instincts overpower you. Hence, sublimation will be the correct answer and not anything else. Does this make sense for everyone? Is this clear? Yes? Okay. Any doubts till now? Is the pace fine? Okay. Yes. All right. Let's do another question. All are characteristic of conversion disorder except. Okay, yes, very good. The correct answer is option D. The correct answer is option D, which is gradual, planned in response to conflict. Conversion disorder में क्या होता है? Your psychological symptoms are a lot of times getting converted unconscious, it is sudden. All right? So gradual and planned का पूरा उल्टा होता है. Motor and sensory symptoms होते हैं, that's correct. Label indifference क्या होता है? Who will tell me this? What is label indifference? Exactly. The patient themselves is indifferent to the symptoms. कि फॉर एग्जाम्पल क्लासिक कन्वर्जन डिसऑर्डर में होगा कि फेंटिंग बिहेवियर बहुत ज्यादा होता है. ओके, सो द पेशेंट व्हेन दे फेंट, yes, they are not seeing their particular system as a distressing factor. The patients are not seeing their particular symptoms as an issue that they have to come up with or as a complaint. कन्वर्जन डिसऑर्डर में जो आसपास के लोग होते हैं वो जनरली पेशेंट को हॉस्पिटल में या क्लिनिक्स में लेके आते हैं. व्हाई? बिकॉज द पेशेंट इज वेरी इनडिफरेंट टू द सिम्टम, बिकॉज फॉर देम दैट सिम्टम is helping them not face the anxiety, is helping them not experience the stress. So the patient themselves, they are indifferent to the symptoms that they experience. This is something which is very classic of conversion disorder, और घुमा फिरा के कहीं ना कहीं पे ये वाला पर्टिकुलर चीज आएगा ही. All right. And non-volitional etiology. Volitional मतलब? What is volitional? In control. Exactly. Volitional मतलब in control. आप अपने हिसाब से, आप अपने विल के हिसाब से कर रहे हो. ओके. कन्वर्जन इज नॉन वोलिशनल. क्यों? क्योंकि ये नॉन वॉलेंट्री है, हम खुद से कर नहीं पा रहे हैं. आई कैन नॉट कंट्रोल इट, आई कैन नॉट मेक इट हैपन ऑल्सो. सो दिस इज, so conversion disorder is unconscious, sudden, it is non-volitional in nature. Cool. Now the other one. Next. The correct answer is B. Correct. Parkinson's. Okay. अगर डोपामीन बहुत ज्यादा हाई है, बहुत एक्सेसिव डोपामीन है, तो क्या कॉज होगा? स्किज़ोफ्रेनिया. वेरी गुड. तो स्किज़ोफ्रेनिया जब किसी को होता है, व्हाट डू वी गिव? वी गिव देम एंटीसाइकोटिक्स. एंटीसाइकोटिक्स का रोल क्या है? What is the role of antipsychotics? Block dopamine receptors, decrease dopamine level. So basically the goal of antipsychotics is to reduce dopamine. अब अगर डोपामीन कम हो रहा है तो क्या होगा? Not reduce hallucination and delusion. Basically dopamine is the one which is causing the symptoms. Yes, so the goal is to reduce dopamine. बायोलॉजिकली द गोल इज टू रिड्यूस डोपामिन. अब अगर डोपामिन रिड्यूस हो रहा है तो क्या हो रहा है? मोटर इश्यूज. करेक्ट, मोटर इश्यूज which is called extrapyramidal symptoms. Extrapyramidal symptoms basically means motor issues, जिसमें क्या होगा? ट्रेमर्स होंगे, इनवॉलेंट्री शेकिंग होगा, which is what? Very similar to Parkinson. Yes, very similar to Parkinson. And इसीलिए एंटीसाइकोटिक्स का साइड इफेक्ट इज extrapyramidal symptoms. एंटीसाइकोटिक का साइड इफेक्ट्स becomes extrapyramidal symptoms. इसीलिए जब एंटीसाइकोटिक्स आप काफी बार दे रहे हो, फॉर अ प्रोलॉन्ग पीरियड ऑफ टाइम अगर आप दे रहे हो, सो देयर इज अ हाई चांस कि एक्स्ट्रापेरिमिडल सिम्टम्स होंगे विच माइट गेट कन्वर्टेड टू पार्किंसंस. दैट इज वाई अगर मोटर इश्यूज दिखना स्टार्ट हो रहे हैं, you need to also add anticholinergics to their medication to reduce the side effects. I hope it's not very complicated. थोड़ा ये रीड करना पड़ेगा क्योंकि कभी कभार क्वेश्चंस में पूछे जाते हैं कि एंटीसाइकोटिक्स का साइड इफेक्ट क्या होगा. एक्स्ट्रा पेरिमिडल सिम्टम्स बहुत ज्यादा होते हैं. ओके, करेक्ट. साइड इफेक्ट ऑफ एंटीसाइकोटिक्स विल बिकम एक्स्ट्रा पेरिमिडल इफेक्ट्स, सॉरी, एक्स्ट्रा पेरिमिडल सिम्टम्स, which is basically your motor issues, tremors, all of that. So all of these questions can come. Okay. Alzheimer's क्या होता है? Alzheimer's is a type of dementia जिसमें कॉग्निटिव लॉस बहुत ज्यादा होता है. ओके, टाउ प्रोटीन्स के कारण भी हो सकता है. करेक्ट, टाउ प्रोटीन्स एक्यूमुलेट होते हैं जिसके कारण होता है. ओके, व्हाट इज कोर्साकॉफ? व्हाट इज अल्कोहल अब्यूज? करेक्ट, जब आप बहुत ज्यादा अल्कोहल लेते हो, विटामिन बी रिड्यूसेस. विटामिन बी रिड्यूस होता है तो थायमीन डेफिशिएंसी होता है. Because thiamine deficiency is happening, yes, what will happen? A lot of memory loss will happen. इसीलिए as a result, one of the symptom of Korsakoff syndrome is confabulation. Confabulation basically means जो memory gaps होते हैं लोगों के mind में, they try to cover up the memory gaps by building either fake memories or memories which is closely related to what they experience. तो बहुत बार वो कुछ भी उल्टा पुल्टे चीजें बोल देंगे. Hence, confabulation becomes a very important symptom. Correct. It's also known as alcoholic amnesia. What is Huntington? What is Huntington disease? It's a neurodegenerative disease. Correct. HTT gene mutation के कारण होता है. Correct. What else? HTT जीन कौन से क्रोमोसोम में होता है? ये ना एक एग्जाम में आया था. क्रोमोसोम 4 में होता है. करेक्ट. HTT जीन क्रोमोसोम 4 में होता है. इट्स अ न्यूरो डिजेनरेटिव डिजीज. बहुत रिजिड जर्की मूवमेंट्स होते हैं. ऑलराइट, अनकंट्रोलेबल मूवमेंट्स होते हैं ये. Lot of uncontrollable movements which is seen. And because it is a genetic disorder, yes, कभी कभार चिल्ड्रन में भी देखा जाता है. यस, करेक्ट. बैलेंस इश्यूज होते हैं. सीएजी में वो प्रॉब्लम होगा, कोरिया होगा, ब्रैडीकाइनेसिया होगा. ऑल ऑफ दिस विल हैपन. फॉर पीपल हु आर फाइंडिंग ऑल ऑफ दिस इज वेरी न्यू टर्म्स, ठीक है, वट एवर टॉपिक्स वी आर डिस्कसिंग नो टुडे, go home and just read about those topics. Just skim through it I'm sure all of this is something which you have studied in your bachelor's and master's. Just एक बार अच्छे से revise कर लो. Okay? All right, who's going to answer this? Option D. Or anyone? Anyone else who wants to try? Okay. I see confusion between option C and option D. Okay. Deepti, can you tell me why do you think it's option C? You want to try? Okay. Option C is actually the correct answer. Okay. Aplysia क्या है? Aplysia is basically a sea slug. It's an animal. ठीक है? जिस पे ये वाली स्टडी कंडक्ट किया गया था. Okay. Now, what the question is trying to understand is कि हमारा जो biological basis है, okay, learning and memory का, वो क्या है? That is what they are trying to understand. ठीक है? So this entire study was created to understand the biological basis of it. तो after this study, what we understood is कि जब भी structural changes होंगे, chemical changes होंगे, yes, हमारे synapse में, that will directly impact our learning, that will directly impact our memory, is what they understood. Okay, so the correct answer is going to be structural and chemical changes in the synapses. What is proprioceptive feedback? People who answered it as C, what is that? I'm assuming neuroplasticity you mentioned for option C. हाँ, okay. Proprioceptive feedback क्या होता है? Exactly. Our body's understanding of balance in space. हमारे body को पता है कि हम खड़े हैं तो कैसे खड़े हैं, हमारा हाथ का है, where is our leg, how is our body movement. Okay, so it is our body's sense or understanding of its own position. Correct. Specifically limb position. तो हमारा बॉडी का जो स्पेशियल नॉलेज है, दैट इज कॉल्ड प्रोप्रायोसेप्टिव फीडबैक. Yes, that is not something which is to do with learning. So that's why ये चीज नहीं होगा. Then we have insight learning. Insight learning में remember वो कोलर का chimpanzee experiment. Read about that. And heritable neural changes. Aplysia में they were trying to understand कि what about aplysia is leading to. I'll answer your questions, Nidhi, 1 second. Aplysia, when they conducted study on aplysia, they were just basically trying to understand कि, what is impacting our learning, what is impacting our memory. Okay, nothing to do with genes, nothing to do with heritability. That's why this option will also get eliminated. Does it also related to the brain mapping? Yes, brain mapping of where our body position is. ठीक है, आपने सुना होगा कि a lot of people, war veterans especially, who lose their limbs, yes, they can still feel some pain, or they can still feel that phantom pain. Exactly, yes, that phantom pain is also because our body has its memory of how our body positioning is, what our spatial knowledge of the body is. Okay. Although phantom pain का concept is also related to the gate theory of pain थोड़ा. Yes, but it is also a derivation and it's also rooted in हमारा brain हमारे body को कैसे map करता है. हमारा spatial awareness क्या है body का, positioning क्या है, sense क्या है. Okay? Fine. Um, all right, let's try this particular question. Option B. Okay, all right. I'm sorry. Yes. Why do you think it's option B? Conservation क्या होता है? What is conservation? Correct. The correct answer is option D. Okay. What exactly do we mean by conservation? In the most simple terms, ठीक है? We are trying to understand कि जो shape और quantity है, is that remaining the same? Okay. जो क्वांटिटी है अगर हम उसका शेप चेंज कर दे तो क्या क्वांटिटी सेम रहेगा नहीं रहेगा. बड़ा ग्लास है पानी का, छोटा ब्रॉड ग्लास है पानी का, in that is the thing same. Okay, so in the very basic sense, understanding quantity, okay, understanding how shape plays a role in quantity. Yes, प्री ऑपरेशनल में तो बच्चे बहुत छोटे होते हैं ना, they are still trying to make sense of what is happening around them. Yes, what develops in pre-operational is egocentrism. In pre-operational, कंजर्वेशन अभी तक हुआ नहीं है. मे बी कंजर्वेशन प्रॉब्लम्स दिखाई दे रहे हैं, बट इट्स नॉट रिजॉल्व्ड, इट्स नॉट डेवलप्ड येट. That development will happen in concrete operational stage, where the age is somewhere around 7 to 11 years. Okay? Oh, so it's okay. Yes, in conversation, maybe yes, pre-operational में conversation start हो सकता है. Okay? The characteristic feature of formal operational stage is abstract reasoning. That is what gets developed in formal operational stage. Okay? Sensory motor में होता है हमारा object permanence. That is what gets developed in object permanence. Okay? All right. Should we move ahead, everyone? Let's try to do one question from social psychology, pro-social behavior. Very good. The correct answer is empathy, altruism hypothesis. Okay. Helping behavior basically means pro-social behavior. The question is trying to understand ki, why do people indulge in pro-social behavior? Okay, they indulge in. Is someone saying something? Okay, they indulge in pro-social behavior. Why? Because firstly, they can empathize with the other person. Okay, and hence their altruism increases. प्लीज सबको ही प्रो सोशल बिहेवियर एंड ऑल्ट्रुइज्म के बीच में डिफरेंस समझना. गो बैक एंड रीड अबाउट दिस. नथिंग टू बी एक्सप्लेन, बट इट्स अ वन लाइन डिफरेंस. वो कभी ना कभी आएगा ही. ओके, अ लॉट ऑफ टाइम नेगेटिव स्टेट रिलीफ के कारण भी ऑल्ट्रुइज्म होता है, बट इन द क्वेश्चन इट इज मेंशन मोटिवेटेड प्योरली. Negative state relief is basically what? I am not feeling good about myself today. Okay? I am doing it because I'm not feeling well, so I want to reduce my own distress. इसीलिए काफी बार people will go and help the other person. All right? Like Sunidhi mentioned, pro-social is done for your personal benefit. It's done for your personal benefit. You will get something in return. You will get something in exchange. Altruism is very unconditional. Okay? Social exchange theory में क्या होता है? Basically cost and benefit. अगर मैं ये करूंगी तो मेरा कितना लगेगा? How much energy do I have to give? How much will it cost me? And what will I get in exchange of it? What is the benefit that I will get in exchange of it? Okay? Reciprocity norm basically means return expectation. मुझे रिटर्न में कुछ मिल रहा है कि नहीं मिल रहा है. All right, that is reciprocity norm. And as you all mentioned, the correct answer is going to be option B. Of getting through crash interview and getting the MA seat, like your prep, how the interview. Yes, yes. Okay, let's do the next question. I realized that the class was scheduled to be from 6 to 7 p.m. and we are slightly exceeding the time limit, but if it's okay with everyone, I would like to finish the already set of questions that I have. There are around 6 to 7 questions more, so I'm targeting कि next half an hour में मैं complete कर दूँ. Okay? All right, yes. The correct answer is A, Alzheimer's disease. Why? क्योंकि Alzheimer's disease में it's a very interesting phenomena, but Alzheimer's में ना जो भी confusion होता है, जो भी agitation होता है, that actually increases in the evening. Yes, that increases in the evening, hence sundowning. Sundowning means basically sunsetting. जब भी evening होता है. This is not something which is seen in alcohol dependence, schizophrenia, or insomnia. Hence, Alzheimer's disease is the correct answer for sundowning. This is also a common question which you get asked. So basically, जो cognition है वो कम हो जाता है evening के time पे. All right, let's do the next question. Who gave the concept of borderline personality organization? Okay. All right. The correct answer is option C, which is Otto Kernberg. Okay. Please make a note of this. All of this memory-based direct question, कौन से year में क्या हुआ, किसने क्या दिया, all of this is very important. The people who are extremely important is your Eugene Bleuler. क्रेपलिन ने क्या किया है, okay. क्लिफर्ड बियर्स ने क्या किया, एना फ्रॉयड का क्या कंट्रीब्यूशन था. All of these people are exceptionally important. कहीं ना कहीं से घुमा फिरा के ये पूछते ही है. Even for that matter, Mahler also, Kohut also. कहीं ना कहीं से घुमा फिरा के they will ask you. So please be very thorough with their contributions, what they have done. Okay. The correct answer is Otto Kernberg. Primarily because Otto Kernberg gave a lot of, added a lot of contributions to the object relations theory. Object relations theory, which is originally given by Melanie Klein. Okay, Winnicott ने भी और ऐड किया है, Otto Kernberg ने भी ऐड किया है. He contributed a lot to the object relations theory, and उसमें there was a lot of understanding developed around splitting, which is a defense mechanism जो बहुत ज़्यादा borderline में देखा जाता है. It's very specific to borderline. A lot of identity diffusion. And all of this contribution was made by Otto Kernberg. People who mentioned Kohut, okay, this he gave self-psychology, okay, and he spoke a lot about the concept of mirroring, which is seen in narcissistic personality disorder. Sorry for my handwriting. Which is seen in narcissistic personality disorder. Okay, cohort is more closely related to NPD, but Kornberg is more related to borderline personality organization. But also realize कि यहाँ पे borderline personality organization दिया है, borderline personality disorder नहीं दिया हुआ है. So in borderline personality organization, they are trying to understand the core of borderline personality. Also, why do you think it's called borderline? It's the borderline of what? Exactly. It's the borderline between neuroticism and psychoticism. They're literally in the borderline of neuroticism and psychoticism. They can go either ways. So if you notice in BPD, आप जब clinical postings होगी, जब आप work भी करोगे, then you'll realize कि BPD में manifestation कुछ भी हो सकता है. Psychotic symptoms भी हो सकते हैं, neurotic symptoms भी हो सकते हैं. So it's very essential to understand and reduce the difference and समझना कि ये schizophrenia है, psychotic disorder है, BPD है, क्या है. Okay, but borderline between neurotic and psychotic. मार्गरेट मालर ने separation and individuation की बात की है. He has given a whole theory based on it. Please go home and read about it. Okay, Carl Jung has done a lot of work on analytical psychology, spoken about archetypes. Okay, usme there is your anima animus. Please remember the difference between the two. You get asked that. They ask you about shadow as one of the archetypes. There are a lot of different archetypes also. Go through that. Analytical psychology. As discussed, Carl Jung ने personality में भी बहुत role play किया है. So gave a lot of information about extroversion, introversion. Yes. Okay. Next question. Which statistical test is most appropriate when comparing three independent groups using ordinal data? Crystal Wallace. Correct. Ordinal data. Ordinal data is our hint that it is going to be non-parametric. अगर non-parametric है तो Crystal Wallace है. अगर parametric होता, that is interval या ratio data use होता, तो one way ANOVA होता. Okay? तो one way ANOVA होता. Mann-Whitney U test, quickly, is it a parametric or a non-parametric test? Non-parametric. Non-parametric of what? T-test. कौन सा? Independent. Correct. This is for independent t-test, and Wilcoxon is for paired sample t-test. It is the non-parametric equivalent of paired sample t-test. All right. Please remember this. किसका क्या non-parametric equivalent है? For repeated measures, ANOVA क्या है? Treatment. Correct. Very good. Remember all of the tests. Okay. Next question. Option is B. There's a confusion between A or B. Okay, fine. The best rule, okay, to answer any question, जहां पे भी emotion लिखा हुआ है, okay, जहां पे भी fear and emotion लिखा होगा, अमिगडाला कहीं ना कहीं से आ ही जाएगा. Alright, अमिगडाला कहीं ना कहीं से घूम फिर के आ ही जाएगा. So अगर अमिगडाला आएगा, then every other option becomes wrong because amygdala is only over here and that is option B. Yes, but in case there was amygdala mentioned somewhere else also, just letting you know ये कौन से theory का part है. That theory is a little elaborate, so maybe you can just go back and read about it. It is the low road fear theory. Sorry. It is the low road fear processing, which is given by led to. Okay, read about it. It is a very short path, very responsible for your survival. This is something which is there. Fear hai, emotions hai, it has to be amygdala. Cool? Quickly, what is the role of hippocampus? Memory, very good. Hypothalamus? Homeostasis, very good. ठीक है. Prefrontal cortex, as we know, through executive functions and all of that. Recommend books. Sure, this is something we'll take up at the end. Okay, next. A therapy that focuses on exaggerating bodily movements to increase awareness. I see people already answering, and yes, the correct answer is gestalt therapy. In gestalt therapy, there is a lot of focus on the here and now. क्योंकि here and now में focus हो रहा है, so we are trying to understand कि हमारे बॉडी के सेंस करते हैं. ठीक है, 2 chair टेक्निक्स होगा, बहुत सारे वैसे टेक्निक्स होंगे जो हम जेस्टॉल्ट में यूज करते हैं. Okay, as we know, cognitive therapy is more about, maladaptive beliefs, maladaptive thoughts, false beliefs, all of that. Client-centered therapy, Rogers ने दिया है. DBT is more suited for borderline personality disorders. Okay, DBT बहुत ज़्यादा पूछे जाते हैं. It has 4 components. What are the 4 components? DBT. Mindfulness, correct. What else? Instead of distress management, the correct word is distress tolerance. What else? Interpersonal effectiveness, correct. एक और है. Emotional regulation. Very good. This is also very important. Please read about it. Okay, next question. A fixed pattern is best described as? Your guess is correct, both of you. The guess is correct. The option is D, which is our innate behavior triggered by a specific stimuli. Fixed action behavior आप ऐसा सोचो कि, for example, imprinting. Yes, imprinting जो हम डक्स में देखते हैं, it is more of a fixed action pattern. कि वो innate behavior है जो trigger हो जाता है. Whenever they see whatever the first object is moving around them, they will start following them. They will start treating them as their caregivers. That is a very innate behavior which is getting triggered. Okay, so fixed action pattern is a very innate behavior. बाकी 3 नहीं होगा because it's all learning based. अगर learning based है, then it's modifiable. And if it's modifiable, then it's for sure not fixed. Yes? Flexible है तो fix नहीं है, learned है तो fix नहीं है, punishment है तो भी fix नहीं है. Punishment अगर हटा दिया जाएगा तो behavior change हो जाएगा. So for everyone else who was confused with this particular thing, you can correlate it like this. Cool? Quickly thumbs up if everything is okay till now. All right, thank you. Now, which memory system is most impaired in Korsakoff syndrome? We just discussed in brief about Korsakoff. क्या होता है? Okay. Priyanshi is saying C. Okay, I'm getting a lot of mixed responses. सबने चारों बताई दिया है. Now, very interesting part about Korsakoff is, Korsakoff में अल्कोहल होता है ना, आप ऐसे याद रखो कि Korsakoff में अल्कोहल होता है. पीपल हु ड्रिंक अ लॉट ऑफ अल्कोहल, उनको बहुत ज्यादा ब्लैकआउट हो जाता है ना. उस दिन क्या हुआ क्या नहीं हुआ याद नहीं आ रहा है. यस, व्हाट इज दैट? विच मेमोरी इज दैट? एग्जैक्टली, दैट is option B, which is your episodic memory. So, episodic memory is something which gets impaired the most in Korsakoff. Mostly preserved. इसमें बहुत ज्यादा impact नहीं देखा जाएगा. Okay? It is relatively preserved. What gets most impacted is your episodic memory. ऐसे याद रखो, blackout के term से क्या हुआ याद नहीं आ रहा है. Okay? Semantic memory might get disrupted, but in the later stages. Not in the initial stages, and सबसे ज्यादा impact इसमें नहीं पड़ेगा. Okay? And sensory memory में नहीं पड़ेगा, because sensory memory is basically you know what, it's extremely short lived. It's basically us receiving information then and there. Yes, so sensory memory is very short lived. उसमें ज्यादा impact नहीं पड़ता है. The most impact is procedural memory. See, alcohol can lead to imbalance, which can affect procedural memory. Alcohol is causing imbalance only for a while when there is alcohol intoxication. Yes, तब imbalance होता है. But Korsakoff syndrome is what we are talking about, is someone who has used alcohol for a really long time. उनके body में there's been a lot of changes. Yes, there's a lot of changes. So the imbalance is not seen as an aftermath of alcohol. It is seen during the period of intoxication. And when we talk about procedural memory is what? It is a non-declarative memory, something that you can't experience, something you cannot verbalize. So it is extremely based on your muscle memory. Yes. For example, you're cycling. For example, swimming, walking. Yes. So procedural memory is something जो आपने इतना कर लिया है कि वो आपके अंदर एकदम imbibe हो गया है. Yes. Hence, procedural memory is not something which is most impacted in Korsakoff. People with Korsakoff, they still know how to drive. They still know how to walk. Gait problems हो सकते हैं. Posture problems हो सकते हैं. Attention कम हो सकता है जिसके कारण ड्राइव ना कर पाए. But that does not mean that they've forgotten how to walk. They've forgotten how to drive. These are two different things. Yes? Yes. And please remember the flow of memory. ठीक है? We have our sensory memory. We have our short-term memory. इसमें we also talk about the working memory model. Badley and Hitch, very important. Slave system क्या है क्या नहीं है, very important. Then we have our long-term memory, which is broadly divided into declarative and non-declarative memory. Declarative is further divided into episodic and semantic. Non-declarative is our procedural memory. Please remember this flow. Okay? And we have oh, correct. This was the last question of the day. We are done with 20 questions. What I would like to ask is, how was your experience? क्या लगा, difficulty level कैसा था? Questions का difficulty level कैसा था? Moderate. Okay. Based on your personal understanding, based on your personal judgment, how many of this could you solve? How many questions could you solve? कितना correct हुआ नहीं हुआ? 70% you could solve. That is very good, Tweena. Others? Okay, that's nice. 70% of the questions you both could solve. That is very good. Now something about the Christ entrance exam is कि बहुत ज्यादा ना घुमा फिरा के complicated questions they did not ask us. Okay. Christ entrance exam was comparatively more direct questions. Okay. More easier to locate questions. Yes. So as you all mentioned, the level of the questions were moderate to high. You in every paper you will find few questions जो नहीं देखा होगा कभी सुना नहीं होगा and that will be your 20 to 20% questions होंगे ऐसे जो कभी देखा नहीं है सुना नहीं है. You write any of your MA papers and any of your entrance exam, even in NET, there will be few questions like that. Yes. But the other questions was relatively more direct, which is kind of a plus point. Okay. So this particular thing was designed keeping in mind the moderate and the high level that Christ follows. And any feedback for me? And did you think that you ended up learning more than what you came with an hour ago? Yes. Okay. Yes. That's nice to hear. Thank you. Okay. Thank you so much, Trina. Um, okay. Now I see a lot of more questions. I think I will um pass on this to Vidhi and she can take it up and she can definitely guide you all further.
Yes. Thank you for such a wonderful session. And I'm sure that, everybody got to learn a lot more than what they had come with. So, yes, I'm waiting for Manvi to present her screen. Till the time, I'll also see what's there in the chat box. Yes, so is my voice fine?
Yes, you're audible now.
Okay, great. So I was just thanking Rishika for the session, and I'm sure that everybody, is leaving with a lot of learnings. So, Manvi, will you be presenting your screen? Yes. So I'm sure that everybody loved the session. They just attended and they got to learn a lot. So, because the Christ University's MA Clinical Psychology RCI exam has been actually preponed and we have some less time in our hand, we thought to come up with this entire MCQ solving course where we're gonna have 10 such sessions of 2 hours each, where we'll solve questions in a similar format. And most of the questions would be the real ones that have actually been asked in the Christ entrance and other MPhil slash MA clinical RCA entrances too, to give you sort of a real time experience of how it is like. Because not a lot of colleges release their question papers, so there's a lot of ambiguity in terms of what to expect, the kind of questions that are highly repeated, or the themes that you should go over in more detail, right? So to take care of that, we will be ensuring that we're only doing those topics which have a higher chance of being asked. And as you must have seen in today's session as well, Rishika was taking us through the follow up questions, the related questions as well, right? So the same format will be followed here as well. So that is about the course. And it'll be done in January because the entrance is on 7th February. Even the interview, everything is on 7th February. So we'll make sure we're done by January end. The classes will be on weekends, Saturdays and Sundays, so that
you have all the 5 days of the weekdays to do your own self study, your own preparation, and it will be in evenings, sometime when everybody is free from their college, so that you can attend live, because MCQ live attend करके ही maximum benefit मिलता है, and it will be there on Zoom itself. So yeah, now one takeaway from me is that why this course? Because you will not find a lot of MCQs online, right? Specifically for Christ, because this course, MA Clinical RCI in Christ itself, usko bas ek hi saal hua hai aaye हुए. So you will not find a lot of MCQs online, which is why we have tried to, gather it all in one place. So yes, if anybody is interested, you can reach out to me or Manvi. We'll help you with the details. And I'm also seeing the chat if there are any questions. So, yeah, I see Sakshi's question. If we want to take admissions for masters, so Sakshi, could you please expand upon what your question is? Okay, I'm not sure if she is here. I'll move on to the next question. I wanted to clarify this, but I received an option to take the RCI exam on 7th and 14th Feb, and I opted for 14th. Is that the same for everyone else? So I think you can get it clarified from someone else who may have filled the form just like you. But if the application form is saying that it's the same thing, and if you're getting two choices, then probably could be the same, but just make sure that the course is MA Clinical Psychology RCI and not something else. Okay, Tweena is saying she only got 7, so you can also get it clarified from Christ itself. You can mail them, and they usually reply within a few hours. I want to take admission for Masters in Christ. So, okay. So, Christ round one has already happened in December. A lot of our students actually got into, but the second round is going to happen in April. Getting in the second round can be a little difficult because most of the seats already get filled by that time, but it's not impossible. If you prepare according to the syllabus that's there, then you can get in and focus more on the interview, right? Focus more on your conceptual clarity, your articulation skills, the way how you speak in front of someone, how you can demonstrate and translate your knowledge verbally, right? So, if you practice a lot of speaking skills from today itself, depending upon what course you have selected, then you can get in. Of course, if you like more personalized or specific guidance, you can reach out to us on text later. Um, would tell about the personal interview. So we have a separate course for the interview preparation, and the one that you attended is just for the entrances. So if you're talking about the PG, then we have we already have a PG interview preparation course. It has already been done. You can reach out to us for the recordings. For every clinical RCI, if there is demand and if we have time, we can think of launching some interview course. And yeah, the micro presentation and skill assessment, all of this is covered in the interview course. Regarding how is the RCI course at Christ, I believe Rishika will be able to answer that better because she's studying there. I'll just skim through the chat and see if there is any question for me. Uh, Experience of RCI interview micro presentation. So yeah, this is something that we will be covering in detail in one of our interview sessions. This one is for the entrance only. Uh, yes, yes. So that's why like there's a separate session for this. This one is only for entrance. I'll have to reiterate that to all those who are asking. We'll organize a separate thing, right? Because it's not possible. Rishika must be having work or sessions after this. This explanation requires like a detailed guidance of like 30 minutes to 1 hour. It's not possible to share this over here. We'll definitely organize something separate for this. Yeah, so the rest of the questions. Rishika, are you here? Would you like to share your experience about the course very briefly?
Hi, yes. So I see a lot of questions about the course, and the course is actually nice. We have different hospitals that we are posted at. So one important thing over here is कि there is only 10 seats. Okay, so the competition is going to be high. There is only 10 seats, so prepare well. And the course is very nice in terms of we have Monday to Thursday, our hospital posting is there. Friday and Saturday is when we go to the college, and in college we cover our theories and we have our academic presentations, all of that going on. We learn the assessments. Monday to Thursday is what is allotted for us as the posting days. And so what will also happen is कि पहला जो 1.5 months था, it was purely theory to make sure that all 10 of us were on the same page, and जितने भी assessments and all है, all of us knew about the assessments so that we were not blindly just going to the hospital. So all of the important assessments, how to administer, score, interpret, all of that was covered. And then we started our posting. Now in posting, since it's 10 of us, 5 of us are posted in one hospital, the other 5 is posted in another hospital, and it gets what do we say? Rotation hote rehta hai. So now my posting is gonna end soon in the hospital where I am at, and then I'll be going to the other hospital. That will happen. What Christ has done is Christ has signed a lot of MOUs with different. My experience as the course has been pretty good. It has been decent. Definitely because Christ is launching this course for the first time. So we did face a few management issues here and there, but overall, it was okay. Yes, it was comparatively okay, and वो धीरे धीरे करके cover up होगा. But I feel there's a lot of gap between what we are taught and see, no, it's not must. Kannada is not a must. Although, in the first 1 year, we were given classes for Kannada, but hospitals में जाने के बाद we realized that you will get a lot of Hindi speaking clients, a lot of English speaking clients, and it's gonna be fine. And in your batch, if there's like any 1 or 2 people who speak Kannada, that's also going to be fine. For me, at least, मेरा जो hospital है, there are a lot of medical interns also over there who speak Kannada. So manage हो जाता है, but majority English and Hindi is going to be fine. It's not mandatory to know Kannada. You definitely, it's easier for you if you know Kannada. Um, about doing a master's first to cover up a knowledge gap. Um, you can go ahead, but I don't think you will need a 2 year intensive master's course to cover up a gap. It might be a little more extra effort. You might have to refer to, more resources to be able to fill the knowledge gap, but take advantage of the 4th year thing and get into the MA course because RCI is changing its regulations a lot. जितना जल्दी license आएगा उतना जल्दी better होगा. Don't delay the process by another 2 years is what my suggestion is going to be. Secure yourself with a license. Yeah, 10 seats is very unrealistic. That is very true. Um, you cannot join after 3 years. You have to do a 4th year bridge course. It's either 4 years of bachelor's and then you get into an MA clinical psychology course, or it is 3 years of bachelor's, 2 years of master's, and then the course. Doing a bridge course is mandatory. Uh, how many people apply to Christ? I don't know exactly, but मैंने जब दिया था अपना एग्जाम then I think everything happened in like 2 weeks के अंदर the course came out and the licensing got approved and we had to travel and everything. So when I gave the course, when I sat, there was approximately, I'm not sure, but based on the volume that I saw, it was somewhere around 400 to 500 students. And especially when Christ ने advertisement नहीं किया था उस time पे. इस बार it's already been 1 year and Christ has been advertising this course a lot. Last time there was no advertisement. The only people who got to know about the course within like the few days were the alumni members. Yes, and very few people here and there जो लोग LinkedIn and all में follow कर रहे थे. So advertisement was not a lot. This time it's going to be a lot. So I'm just assuming that the volume of the students applying for the course is going to be very high as compared to last time. Yes, I see. I understand there's a lot of apprehension about the knowledge gap, especially for bachelor students. It seems extremely unfair for you all. But firstly, make use of this crash course which is going to come up. I'm going to make sure that I'm going to do a lot of PYQs and a lot of MCQs, which is extremely focused on what the Christ, what the college asks and the topics which is heavily asked. So what we have decided to go ahead with the module is because there's like 6 modules, so we've decided to focus one session for each module, then do the so we are trying to make it as comprehensive as possible given the limited time. So make use of this. And other than that, because it's only one month left, I would suggest don't pick up any new books. I would suggest don't do anything, like don't do any new sort of a studying. Just focus on practicing more and more. Take advantage of this crash course. Apart from this, go back and solve as many more MCQs as you can. But please don't try to, starting se padna, scratch se padna, don't do that. And I'm sure you can do it. Okay, just try your best for the next 1 month. I am sure that will happen. And just focus on practicing what you've already learned. Solidify what you've already learned. Okay, and about interview and preparation and everything, this is something that we are also planning to bring up, and we are hoping ki, like Vidhi and Manvi also mentioned, we'll try to arrange a proper session for that because it's very extensive. जल्दी जल्दी बता के फायदा भी नहीं होगा. So I'm hoping that we can arrange something like that, and that's going to be helpful for everyone. Christ is not paying. Christ is a private institute. Christ is not paying. Only government institutes pay. Christ नहीं pay करता है. Okay, if there's no more questions, then can we please end here?
Yes, we will end here. I think we've answered most of the questions. And we'll also be sending a doubt form for those of you who had questions but were not able to get the answers due to time constraints. There'll also be a feedback form attached in it so that you can share how the experience was like for you, or also some pointers you'd like to share with Rishika and us. So, on that note, thank you so much for joining. I hope it was a wonderful experience for everybody. Let's end here and we'll keep seeing you in our future sessions. All the best. Bye. Take care, everyone.
Thank you so much for attending. Bye, guys.